I will present the usefulness of HIFU therapy for unresectable pancreatic cancer. Even with recent advances in the diagnostic imaging technology, most cases of pancreatic cancer are diagnosed at unresectable stage. The therapeutic effect of chemotherapy and chemoradiotherapy for unresectable pancreatic cancer was not satisfactory. HIFU is expected as a new advanced therapy using ultrasonography. This figure shows the effect range of ultrasound diagnosis and treatment. By increasing and ultrasound intensity and ultrasound irradiation time, the ultrasound diagnosis area is beyond the threshold and moves to the ultrasound treatment area. This ultrasound treatment is HIFU. HIFU effects for the tissue have two effects. One is thermal effect, and another is non-thermal effect, mainly cavitation. The aim is to evaluate the therapeutic effect of HIFU therapy in locally advanced and metastatic pancreatic cancer. Subject 176 patients of unresectable pancreatic cancer. Stage 3 89 patients. Stage 4 87 patients. Case registration and observation period is long term, about 10 years. Here is the therapies of pre-HIFU. The mean duration time until HIFU therapy from diagnosis is 9.6 months. The device we used is fed by the HIFU system. The system has the ability to deliver high-intensity focused ultrasound from an external source deep into tissues with a large convergence angle. The focus is oval shape and the size is 3 by 3 by 10 mm. We treat it by shifting every 3 mm while seeing in real-time US. I'll show one case. Pancreatic body cancer, tumor size 65 mm. Patient was treated by chemoradiation at first and next to chemotherapy, but the therapeutic effect was PD, so the patient was introduced to HIFU therapy. Here is a clinical course. This patient was treated total 7 times in HIFU therapy. The chem menu used continued Gen plus S1, and after the second HIFU therapy, PR and pain relief control were added, and the tumor remained SD until the end. CT image taken after 3.5 years of HIFU therapy. As you can see, the tumor got smaller significantly. This image shows that we able to get anti-tumor effect. Result. Here is a detail of treatment data. There were no serious adverse events. Rate of symptom relief effect was 64%. The effectiveness of primary lesion, the rate of PR was 12%, mostly SD change. Primary disease control rate was 72%. Here is a comparison between stage 3 and stage 4. In the rate of symptom relief effect, rate of no worsen change of CA19-9 level, and the primary disease control rate, stage 3 was significantly better than stage 4. Here is a survival curve after diagnosis of pancreatic cancer of chemotherapy with HIFU versus chemotherapy alone. Chemotherapy group was 100 patients of same period in our hospital. Chemotherapy with HIFU was significantly better than chemotherapy alone. And also in survival curve after HIFU therapy, chemotherapy with HIFU was significantly better than chemotherapy. Here is a survival curve after HIFU therapy of stage 3 and 4. Stage 3 was significantly better than stage 4. Strategy of HIFU therapy. In standard systemic chemotherapy will be done and in local advances of stage 3. As local control, chemoradiotherapy and or HIFU therapy combination for anti-tumor effect and pain control is recommended. In conclusion, this study suggested that chemotherapy with HIFU has significantly better result than chemotherapy alone. HIFU therapy has a potential of new method of combination therapy for unresectable pancreatic cancer. Thank you for kind attention.